So we're going to go ahead and give our guests an extra 10 minutes because this is such an important topic. So I think Paul is going to take the lead on letting you know who our guests are and introducing our topic for today.
Okay, thanks Diane. And thanks to Rita Valenti and Zan Thornton for coming in today. Rita is with National Nurses United, Healthcare Now Georgia. Worked on the with Georgians for a Common Sense Health Plan back in the day. Zan is an activist with ADAPT, and we've been on the streets together recently around what's been happening with the Senate healthcare bill. So what I was thinking we would do with this discussion is kind of back up and put things in context in terms of some history, and then talk about what's going on today, and then move from there to have a discussion about where we think healthcare is moving in the future. So Rita, if you would not mind, could you please give us some overview about healthcare in this country in general and Medicaid in particular, and also keeping in mind about the South, the special characteristics of the South.
Okay, thank you, Paul. Zan, WRFG, great to be here. There's such a broad history around healthcare that I would probably go on a little bit too long if I focused on that, but maybe just honing in on some of the history as it relates to Medicaid might serve us well today. As folks probably know, Medicaid and Medicare were passed in 1965, and their passage was a direct result of the dynamic social movement, the civil rights movement. There can be no doubt that in the absence of that movement, those pieces of critical legislation would not have happened. And some of us feel they're really the last structural reforms that this society has experienced. People have won concessions over the years, and certainly Zan will talk about the amazing concessions that the disability community has raised. But the actual ability to integrate, at least legally, the black population of this country into their respective classes was won as a result of that civil rights movement and the resulting Medicaid and Medicare that came from that. Medicare was always intended to be expanded to the entire population. Medicare, as folks know, is the insurance that people are entitled to after the age of 65, and people have paid into that all their lives. Initially, Medicare excluded domestic workers and farm workers, and today it still excludes undocumented workers, and the ACA excludes immigrants, even those in this country with papers, for 5 years. So we're still not up to speed on that. Medicare also only covers 80% of the cost of the healthcare folks experience, and has increasingly become privatized through Medicare Advantage plans, and we can talk about that if there are particular questions about it. Medicaid also was birthed at the same time, and many of us feel that it was really, to a large extent, a compromise with the Southern Dixiecrats. It always was based in this partnership between the states and the federal government, with the federal government providing some very basic skeletal benefits in terms of Medicaid, and financing, actually a 2-to-1 financing, but the states also, retaining a lot of regulatory power as it related to Medicaid. When Medicaid was passed, the southern states most southern states did not initially sign on to it, not unlike the Medicaid expansion of the ACA, until 1971. And at that time, there were 14 million people on Medicaid. Today, brace yourselves, there are 74 million people on Medicaid, more than even on Medicare today. And Medicaid is a program that focuses in on low-income folks, people with some disabilities, and pregnant women with children. In fact, in the state of Georgia, 50% of all childbirths are associated with Medicaid, right?
Say that again.
50% of the children in Georgia are on Medicaid. And the figures go on and on, but I don't want to bore you with so much of that. I want to make sure Zan really speaks to the fight that we're up against. As people know, the ACA was passed in 2010, and that was always a two-edged sword. On the one hand, it certainly provided some necessary benefits to people. Folks that were under the age of 26 could stay on their parents' health insurance if their parents had health insurance. There was regulations that were imposed on the private insurance industry that they couldn't discriminate against people with pre-existing conditions.
Which is just about everything.
Which is really just about, and there's a story to be told about our insurance commissioner as it relates to that, if we get time. That's really deplorable. Anyway, when the Supreme Court ruled, I think the second time, or maybe the first time, on the legitimacy of the ACA, it said essentially in 2012 that the expansion of Medicaid was coercive to states. And as a result of that, Medicaid expansion was left up to the states to determine whether or not they would do that. And probably the best part of the ACA was the Medicaid expansion, because it was the first time people actually got covered solely on the basis of income. I can't remember what it is. I think it's up to 138% of poverty, and didn't also have to have a qualifying illness or condition or be a child or what have you. Medicaid had always initially been associated with public assistance. And this expansion really freed it from that and recognized that at the same time that the expansion was going on, we had a situation where we had decreasing employment-based insurance. Today, the way that many of us used to be insured, certainly Diane and Paul and myself, was through the job. And I think in the 70s, about 84% of people that had insurance had it from job-based insurance. Today, that figure is approaching 50% and falling, right? So it also accounts for, this tremendous number of people on Medicaid, and speaks to the level of poverty in this country. As people are poignantly aware, the South almost universally opted not to expand Medicaid. The only exceptions to that were Arkansas, who sought waivers, and I want to say one thing a little bit later about waivers, and Louisiana, who had a governmental switch from Jindal to a Democratic governor who expanded Medicaid in the state of Louisiana. But during that process, Louisiana, which had a very interesting and fairly comprehensive system of public health care, was destroyed before that actual passage. So Georgia, what initially happened, there was so much pressure for expansion that Governor Deal punted to the state legislature, which is probably one of the most reactionary legislatures in the country, and said, well, if we're going to expand Medicaid, the state legislature of Georgia has to approve that. And I say reactionary because it was redistricted.
From personal experience.
Right. But the redistricting that goes on, has really solidified the kind of so-called representatives that we have. And excuse me for being angry and honest about that. As it relates a little bit more on Medicaid, and then I'll stop, one of the things that can happen with Medicaid are what is called waivers, and I think Zan will speak more to that. But the waivers have a two-edged sword, because what Tom Price, who also comes from Georgia, who is now the head of Health and Human Services, that came from the congressional 6th district that and followed in the heels of Newt Gingrich, none of whom are friends to health care. What Tom Price has said is that, we'll grant a lot of waivers for the states, and things that would include requirements to work, so-called responsibility requirements that, perhaps even drug testing, which the state of Georgia tried to impose solely on low-income people, not on themselves. There's actually, I think, a congresswoman who's introduced legislation to have everybody with incomes over $250,000 a year drug tested. But the other side of the waiver is really a reflection of the activity of the disability rights community in Atlanta, and that is being able to achieve Medicaid services even if you're above 138% of poverty, and in particular attendant care services, and that has made a huge difference. So the waivers are a two-edged sword, but under these conditions, they're very, very, very dangerous. So just to wrap up, as we know, the bills that have been proposed, both out of the Congress as well as the Senate, the major focus of attack of those bills is on Medicaid. They essentially want to eliminate federal funding for all Medicaid. It's not only just a question of the disability community, whose lives are literally on the line with this, but 74 million other people, and leave it to the states to essentially determine what benefits will be covered, what waivers will be sought, what money will be available, and cap the amount of funds that are available to Medicaid. The way it works now is the need increases, so does the funding, and they want to put an end to that in a situation where our working class is increasingly becoming more and more destitute and does not have health insurance on the job. So finally, the last thing to say is, it doesn't have to be this way. That's the real point of it. I'm sort of a technological nerd, not in that I know how to use technology, but in terms of how I follow the applications of technology as it relates to healthcare. And we have an abundance of resources, an abundance of knowledge, an abundance of, in fact, there's even in the works a wheelchair that will go up and down the stairs, right? And there's just huge amount of resources that could really, really benefit to people. The problem is distribution, because those resources are all dependent on whether or not you have money. And that is not what is necessary at this point. We need to have free and universal health care that's accessible to everybody. And many of us look at single payer, national health insurance program as the first step to that, to eliminate what is essentially a parasitic industry, the health insurance industry, right? Because the more money they make, they make it through the less amount of services they reimburse. So having said that, there is a bill in the U.S. Congress, H.R. 676, introduced by John Conyers many moons ago, that initiates what would essentially be a national single public health insurance program for the entire country, with everybody including undocumented, including immigrants, and certainly with the broad array of services that the disability community needs, and nobody out. And so many of us are working on that. But we do take lessons from the civil rights movement, and while we talk to our congressmen and our senators, we know that it's really a social movement with a vision of healthcare for all that will win us the kind of justice and health equity that we need. Thank you.
Thank you.
Thank you, Rita.
All right.
Zan, if you have any reaction to what you just heard, I'd love to hear that, and also if you want to move into what's going on now. But however you want to go. Go ahead.
Chair's attack me. Hi, I'm Zan, and I agree with everything you said. So we can just quit there. No, seriously. I need to give a little disclaimer in a way that I'm a disabled veteran who's against the wars. I'm also have PTSD and multiple other physical disabilities. And so when I found ADAPT at a local Center for Independent Living, it felt like home. We sometimes go, like women go to women's festivals. There's a variety of places where you can feel at home. And I felt at home with ADAPT. And so I've been with him approximately 25 years. And there's some amazing things that have happened in Georgia, thanks to work from ADAPT, but also allies. One of the things you mentioned, you did an exceptional job, Paul, exceptional. Actually, you did it better than I could. In the protest that we do, you always get the paperwork before, you don't just show up at the office. A lot of people just think we just show up and start protesting. I'm gonna say that's a myth.
Are you
not,
sure?
But the other thing is that, like Rita said, is that I wanna honor the people that came before us, our ancestors, our civil rights activists, and the people that literally gave their lives to us. Because disability rights is built upon civil rights. And if it wasn't for civil rights, we would not have any disability rights.
Exactly.
Yes.
Exactly.
And we think, ADAPT thinks that our lives and liberty should not be stolen, to be given tax breaks to the wealthiest people. I think that's something we can agree. With ADAPT Georgia, we've been here since '89. And doing a lot of different areas. You covered it quite well, the housing. And in the housing, we have a local person that started a nationwide thing. So the second thing we did here is Olmsted. The one thing that was left out is Olmsted. And what Olmsted did was two women that were disabled in an institution, and Sue Jameson filed a lawsuit. And then ADAPT helped get people out in the streets. So Olmsted has said a very, very important thing, is that people go to the most integrated setting possible and appropriate for that person. And then, so ADAPT helped pass that. ADAPT helped MARTA get a little better. The cities that had ADAPT had 90 to 95% improvement on their transportation. But how does it affect us now? Our lives are at stake because many of the people use waivers. If the waivers are capped, or if the waivers are taken away, people will die.
Can you explain what CAP means?
Cap is a maximum amount of money that's allotted for this group. I think, is that the best way to say it?
Yeah, I mean, there's two ways that they're looking at it, and they're both very similar. One is block grant. We will, give the state a certain amount of money based on the number of people on Medicaid, and the figures they've actually been using are the number of people on Medicaid, say for example in the state of Georgia, from 2016, right? So when you hear Governor Deal on the radio saying, don't punish us for not expanding Medicaid, right? They've got, if Medicaid had been expanded in the state, I don't remember the figures, I think it's like at least 600,000 more people would have been eligible, am I right about that? So to block grant, it means that the state would determine how that money is spent, and capping it means it would be capped at the number of people on Medicaid in 2016, and that would be in Georgia and nationwide.
Right.
Is that?
That's why you're a wonderful policy person. We're in the streets activism. Actually, right now there is a action going on in D.C. They visited the Republican Party, and they're staying overnight, I think. And right now the police are taking them away and dumping them out of wheelchairs. This brutality of this era is appalling. In the 60s, people got hit and killed. That stuff's happening now when we go to protest. They really want us gone, and they won't talk to us. And I think it's a crime for our senators to deny people to talk to them and tell them what their lives are about.
Can you say more about why this is a life and death issue?
Well, there's many avenues there. People that have attendant services, which is part of the waiver program. And a waiver is just really an exception to Medicaid. They give you a waiver exception. If you lose your attendant care, that means you can't get out of bed, or you can't get a shower, or you can't get fed, or the daily activities of life. With just minimal supports, people can go out and have productive lives. Without supports, then they end up being put in a nursing home, and we call it a nursing facility because it's not a home. And so people get stuck there, and the average is 6 months. If you're in a nursing facility, you have 6 months to live, you'll die, accidentally or not. it's a horrible thing. Did I answer your question somewhat?
And just one other piece on that, on the nursing home, if I'm not mistaken, while 50% of the children in Georgia are covered under Medicaid, 2/3 of the funding nationally from Medicaid goes into institutional nursing care. And Medicaid is public funds, and all the nursing homes are private for profit. So it's another example of a corporate healthcare system.
It's a transfer of public wealth to private companies.
Exactly.
Exactly, yes.
So, can you bring us up to date about, I know the action that we talked about at Mitch McConnell's, what's happening now in terms of ADAPT and its strategy for dealing with this bill?
Our strategy is to convince them to say no cuts, no caps. How we implement that is that we are using nonviolent techniques to let them know how upset we are. I think it's a crime that they didn't let us have a public hearing. I mean, they've always, even when ADAPT got aggressive, they always gave us a public meeting. So I don't know where to go from there.
We were at, just to share on that,
Yes.
Zan and I were at, that's cool, at Isaacson's office, what was it, a couple of weeks ago, last week,
Last week.
something. And, well, first of all, his office is, the way the place is set up is not very accessible. You have to go up a big hill and all of this. And then they simply wouldn't let the people in, right? Purdue has been totally absent. And so, what we have around this healthcare struggle is also a fight for democracy, right? I mean,
Yes.
these funds are
Absolutely.
public funds, and there is no democracy when they're stealing these funds from us.
Absolutely, that's well said, well said. So we do have, we were at Senator Perdue's office, and they also turned us away. If you didn't have a T-shirt or weren't disabled, they would let you in. So, talk about discrimination.
And no such thing as a public sidewalk
Right.
in front of a,
Right.
what?
In front of the public sidewalk. We know where the sidewalk is, and they wanted to argue with me. And luckily, you know a little techniques how to drag it on a little bit.
Right.
So, the people are now going, you said what's happening with, they're also going today, actually, and they're there now in Mitch McConnell's office, and they're gonna do a sleepover, quote unquote, sleepover, until they get dragged out.
You touched a little bit on this earlier, but can you explain to folks that are listening that may have a medical condition and think that they cannot get on Medicaid or think that they don't qualify for Medicaid, the different types of Medicaid that there are? I know a lot of people think, oh, I can't get on Medicaid because I'm not pregnant, or I can't get on Medicaid because I don't have children under the age of 18. But there's certain different qualifications, right? Could you explain?
Yeah, I mean,
Thank
I'm not an expert on that, because it is so complex.
Yes.
And the
Yes.
complexity is a result of trying to restrict the people
Right.
that can
And
access.
the people won't apply because they don't have that
Right.
information.
Right. Now, first of all, no single man in the state of Georgia can qualify for Medicaid, right? So single moms with kids can qualify if they have a certain income level. That's why you have 50% of the kids in Georgia on Medicaid. Folks with disabilities, and Zan, you can speak more to any of the specifics of that. Medicare actually is the insurance that pays for dialysis, for example. But people, if people have, there are certain medical conditions that are necessary in order to qualify for Medicaid in Georgia, and those are very limited. That's why the expansion was and still is a fight that needs to be fought, as a defensive mechanism, but to go on the offensive for the kind of healthcare system we actually need. This is ridiculous.
Yes.
Because people have to also constantly reapply for Medicaid. And with the exception of and there definitely are benefits to Medicaid. There's no question about it, but all that money is actually going into the main private coffers. And so, you see as a result of that, Dawn, you also see all the closures of rural hospitals. I mean, a lot of them were at risk anyway, but they are definitely, facing major risk at this point.
Could we talk a little bit more about that? The issue, of course, of Brady Hospital and other hospitals, and the increasing number of for-profit, so-called medical institutions, and then even the ones that are called not-for-profit
Right.
are still not public.
Right.
So that means that the heads of it are management companies that can make extraordinary, extravagant salaries and fancy buildings. And so if we could talk a little bit more about the other forms now, all the clinics, all the dialysis, all the
Urgent care centers.
centers and,
Yeah,
and
that's
all of
true.
that, how that all
Which I just
plays,
went to.
all that plays into both maybe some increase of possibilities of medical care, but also makes it even more complicated.
Yes. Well, for example, back 20 years ago, 90% of all the services for disabled people that were institutionalized, a lot of that was in the nursing home lobby. They lobbied hard to keep us there. And now the percentage is like 85% in the community. So that's one thing that ADAPT has done and Umstead. But they've gotten creative with the names. Like you said, assisted living. It is basically a nursing facility, but it is spun a little differently. I don't know the best way to answer your question because I'm not a policy person. I'm not a policy person. I don't know the answer particularly, but I do know that ADAPT has addressed the lobby and has made laws pass because of our action. But you're right, absolutely right about them changing their name and trying to get it a different way. And that we need to be aware of that. And that's a very wonderful idea that you brought up. Thank you.
Yeah, and just a couple of things to add about, I mean, one of the things that we've seen, and it actually began a little before it began before the ACA, but was really accelerated by the ACA, was the consolidation of the delivery system. Because the delivery system had to meet certain standards, and in order to do that, they had to have a broader reach. So we have a consolidated delivery system that is almost exclusively corporate. Even, and I think you're right, Diane, profit or nonprofit, they're private, and they can make it difficult. I have stories of people that we would refer to certain specialty areas who needed those specialty areas that were put at the bottom of the list because they were on Medicaid, regardless of what the need was. So this consolidation took the form of what's called accountable care organizations, and it's both a vertical and horizontal monopolization, increasing concentration and monopolization. Some of us, and I'm not speaking for the National Nurses United or Healthcare Now when I say this, actually harken back to 1974, I think it was, when Ron Dellums introduced legislation for a national health service, which was essentially nationalization of healthcare, so that all the healthcare services were not for profit and were structured in such a way so that they were answerable to the community as opposed to answerable to shareholders or private interests. And I'm just speaking for myself. And actually, this consolidation of the delivery system makes that even more of an issue that needs to be broadly discussed, in all of our communities.
Excellent, excellent.
So, moving more now into the future of where we go from here, with about 10 minutes left. I know, Rita, we had talked a little about this, and Zan too, this word that came up, brutality, today.
Yes.
The brutality of what we're facing today with what happened this morning with Juan at the ICE office, the brutality of what we're seeing with the treatment of the police, of disability rights activists. What are we looking at in terms of the future and where we need to go as a movement overall? And how do we connect dots? That's another question.
Well, the good thing is, in a way, because of all this brutality, people have come together and said, we're not going to take it anymore. We're not going to take this at all. No way. And ADAPT has had more people sign on to what we have been fighting for 20 years than in the past 20 years. Raised more money, done amazing things. But I would rather not have the brutality, and we've got to address that. We know with Black Lives Matter that there is a major institutional racism,
Yes.
ableism, sexism, all those isms. And so I've got to give a shout out to Black Lives Matter.
And the connection between disability incidents involving police killings, because
Absolutely.
It's so
of
high.
Anthony
Yes.
Hill. Is-
Oh, yeah.
Anthony
Yeah,
Hill,
Mm.
Oh, good, yeah.
Keith, I forgot his last name, in Charlotte.
Oh, man, yes.
There's so many cases.
This
The-
Marine,
most of the
just
cases,
at the Wells
yes.
Fargo.
Unarmed.
Unbelievable.
And many, I think it was how much, Paul? Almost 60%?
60% of the police
cases.
killings are involved with people with disabilities.
Yes.
Yes.
I mean, I was on a call last night with folks that were also fighting this same monster from the perspective of mental health, right? And, you know, the saying from Louisiana was, well, we have mental health institutions, they're called prisons,
Uh-huh.
right? And
Or
that's,
jails.
yeah, or jails, right? I mean, that's essentially what is happening, is mass incarceration. Black Lives Matter clearly raised the banner on that issue, and it's affecting the mental health community, black, white, brown, what have you, right? I mean, people are just being incarcerated because those mental health services
Right.
are in such dire shape. And, you know, going forward, I think it is, we have got to congeal as a large social movement, not just as allies, because personally, and I love you, I don't feel like anybody's ally. My liberation is absolutely dependent on yours.
Right, right.
And you know, this thing around this Medicaid really shows that, because nobody is safe. They want to further privatize Medicare. They want to end Medicaid. You know, my health care is not safe either.
Right.
And you know, the more that I'm on your line and on those lines, neither is my life. And so, you know, that I think is what we have to do, is start talking about, you know, where we unite, how we bring, you know, what is really a huge class struggle.
And the root
forward.
causes.
And the
Right.
root causes.
Absolutely.
So I want to ask a kind of a final question. You mentioned that decades ago, a high percentage of workers or families had their health insurance through their job. They had it through their job because they had union contracts.
Right.
That's right.
Let's
That's
go right
yes.
there.
Yeah,
Let's go
you're right.
right there.
You're absolutely
They
right.
had it because of union contracts.
Right.
And so the struggle, we have had so many different union members come on when they're in their contract negotiations, and time after time
Healthcare.
after time, the issue is healthcare,
Healthcare.
Right.
where the employer wants to dump just huge premium in
Right.
costs on workers, and of course, that usually is what is the main issue of a strike. And so I was just wondering if in the closing minutes, we could talk a little bit more about that connection of how it has been, it was the civil rights movement, but it was also the union movement
Absolutely.
that brought healthcare to, you know, literally millions of working class families.
Right.
And now those unions and those contracts are under intense attack,
Yes.
along with literally everything else. So to me, again, I'm speaking to all the union folk out there who are listening, and others, is that we really have to make sure that we are not in narrow silos.
Right.
You know, that a contract at a certain workplace that gets a healthcare benefit, that is a benefit for many more folks, because it's, and when we lose it, it's also a
Gotcha.
loss for all of us.
Absolutely. ADAPT has worked with unions for the 39 years we've been active. Sometimes it's not been positive, sometimes it's been negative, but in the last couple of years, we've come out strongly saying that we have to support unions. We have to get people, have a living wage, have health care, have a right to get a home, and follow those. So that's basically our spin on it, is that we support union. They support us, we need to support you.
And, you know, as I said earlier, I am a member of a very aggressive union called National Nurses United that
It's called
introduced...
militant.
Good. I won't go into the single payer that they introduced in California and was withheld by the Speaker of the House. You had a Democratic assembly, a Democratic governor, and it's still corporate, right? You know, because they wouldn't entertain that bill. But one other thing, Diane, too, and to the unions and to the workplace workers, unionized or not, you're absolutely right. The unions, that struggle enabled people at work, even who didn't have unions, to often be covered on the job. That's sort of number one. But what's happening now is these health savings accounts are being introduced into the workplace, right? And it's not just a question of punting off the premiums, it's also the deductibles. And essentially, the banks are sort of salivating over these health savings accounts because they allow you to put money into the banks to invest for your health care. Now, if that gets tanked, if those investment gets tanked, so does your money for health care. And that was Newt Gingrich's proposal, these health savings accounts. So there's a great deal at risk, a great deal. And I think that's the point of the need for unity, is that I saw a sign recently, we're all in this boat together, you know, whether it's climate change, up against the state, police brutality, we're all in this together as working and poor people in this country.
Absolutely.
So with a couple minutes left, there's a lot of information that people need to understand this issue. And if both of you could take, you know, a minute or two to just let people know what's out there, where they can find out about ADAPT, where they can find out about any resources, so they understand the issue.
Great, this is Zan. We have a website. The major one is adapt.org. It's ADAPT. I'm signing, so .org, and that you can do hashtag adapt and resist, or hashtag DIA. DIA is the Disability Integration Act. Because of Olmstead, what happened with Olmstead is the creative nursing lobby said, we'll name it something else and put people in that institution. So they've got it so that you have to go to a nursing home facility for 6 months before you qualify for Medicare or Medicaid. So am I allowed to give my number out? Okay.
Phone calls.
Okay, phone calls, yeah, 678-358-9540. And my,
One more time.
thank you, 678-358-9540. And then my email is adaptgazan, literally ADAPGAZAN @gmail.com.
Terrific.
And thank you for the opportunity for us to be here today. I appreciate it.
Absolutely.
Absolutely. We have a website and a Facebook page, both locally, Healthcare Now Georgia and Healthcare Now nationally. And just Google Healthcare Now and they'll come up. And we also have a Facebook page. We also, Healthcare Now is working with literally scores of organizations around the country, including many in the South, like Project South, called the Campaign for Guaranteed Healthcare, which is, you know, again, what we've been talking about. While we defend, you know, the ACA and Medicaid, we go on the offensive for national health care for all. So Campaign for Guaranteed Healthcare, you can sign up right on the website and become a member of that and get regular information. And finally, there's another group here that we all work closely with, and that's Physicians for a National Health Program, who also have a Facebook page and a national website, which has a lot of really, really good and up-to-date information.
And they'll be here in
November. PNHP is having its national meeting here in November. I think it's the 3rd and 4th, and so we want you, let you know.
All right.
Just real fast, isn't there an action on Thursday?
July 12th, 10 a.m. across from the Capitol at the church right there. We're going to deliver a message.
And so I think it's at Central Press.
Yes, thank you.
Grab it
Yeah,
at
thank you.
Central Press. All right, thanks so much to our guests. I learned a lot, and this is one of the big issues, and we want to thank Zan and Rita, and of course Dawn, Paul, Christopher, Ozzy, and myself signing off. We'll be back again next Monday. And please do come to our birthday party on the 29th of July. We will hear more announcements on WRG.
Thank you, WRG.
Thank y'all.